So our last speaker, our fifth speaker, is Gail Thomas. She is a writer, actor, lawyer. I didn't know you were a lawyer.
I don't tell people.
Did you ever practice 1 second or not?
A little bit.
Okay. Originally from Oklahoma. I knew that you were different.
Yeah, definitely.
Now living in Brooklyn, you had breast cancer in 2006 and endometrial cancer that had spread to the ovaries in 2009. You were a storyteller and you share your cancer experience with thousands of people both on stage and in podcast. It's interesting because I know Gail for a while and I didn't know a lot of this about her, just that she was a real character. But then she told me, this is like the weirdest thing you said, that when I said, I know I've been seeing you around a lot, but I know that you haven't been in the office. And told me that you were on the Neulasta commercial. I watched that. I love that commercial.
Yeah.
You play the sister.
Yeah.
Yeah, I love it. Just stand up and show.
Oh,
Who watches that Neulasta commercial?
I do.
That's Gail Thomas. You could do autograph. You could do autographs
I've
later.
always been protective of my little sister. When she got cancer, she was the strong one.
Okay, Gail. And she's very active. She rides her bike and she always has her helmet with her.
Isn't that funny? Isn't that sort of weird? Because I'm a cancer survivor, but I got cast as the sister of a woman who actually was a cancer survivor, and it was really touching, actually, to be on set and to be shooting this commercial about a cancer survivor coming home and playing the sister, and I tried very hard to be the sister that I wish my sister had been to me, but she tried. I'm not going to start on a bad note. Let's see. So, and I guess in 2006, I had just a mammogram, just a routine mammogram that showed microcalcifications, which is when I discovered I had DCIS, which is how I met Dr. Axelrod. So she took that out, and at stage 0, I was very emotional and worried and scared, and declined to do radiation or tamoxifen. I sent some slides, I did lots of research. I mean, that's the thing. I think I'm not particularly confrontational, but because I do love research, and I think maybe the law degree makes me sort of dig in and ask more questions than maybe anybody else could possibly think of even. And then in 2009, I was noticed that my period seemed to be going a little bit long. I was just spotting a little bit longer, and I talked to my gynecologist at the time, and she said it was probably nothing, but they did a biopsy, and sure enough, she said I would need a hysterectomy because it looked like it was cancer. She referred me to a hospital and a surgeon in Brooklyn who did the hysterectomy, and they discovered that there was also cancer on my ovaries, so they took everything out. Laparoscopic, vaginal-assisted laparoscopic hysterectomy. And after that, the meeting I had with that particular surgeon, he went from being friendly to being very heavy-handed, and that's not a good approach for me. He wanted me to start radiation the next week. He wanted me to do 6 weeks of radiation followed by 6 cycles of chemotherapy. And I started doing research again and met with a lot of other doctors. And eventually, when he went on vacation, I found my way to Dr. John Curtin at NYU, who I love, as I love Dr. Axelrod. And I asked him pretty much what's the least amount of treatment I can do without seeming suicidal. And he took my slides and all my information to the NYU radiation, I guess it's some sort of board or whatever, and they all talked about me and said, oh, here's the thing. Okay, this is the part. It's funny to be talking about this sort of disjointedly, because I do tell stories about my cancer. I have 4 stories, but I'm trying to just encapsulate everything, and I'm thinking of so many details that I want to share, but I don't have time. So I'll just tell you, so he wanted me to do all that extra radiation, and then I went to the radiation guy at this hospital in Brooklyn, which I won't mention, and this guy said to me, I had no cancer on my lymph nodes. the fluid was totally clear. And so I had this cancer on the endometrial wall and on the ovarian wall. And he said, you know, there's a chance that you don't have stage 3A endometrial cancer spread. There's a chance that you actually have 2 primary early stage cancers, one ovarian and one endometrial. And if that's the case, you don't need any treatment at all, 0. So on the one hand, I have this guy telling me, okay, you've got to do 6 weeks of radiation and 6 cycles of chemo. And on the other hand, I have 0. So I got 3 more pathology reports, and I met all these different doctors, and one of the pathology reports from UMass actually confirmed that it was 2 primaries, which is what led me to Dr. Curtin and to ask him that question about what's the least amount I could do. Because, of course, they never know. People say, oh, well, what was it finally? And it's not like you finally know. What we do know is that I ended up doing no radiation and 3 cycles of chemotherapy, and that was 6 years ago, and I'm totally cancer-free. I'm pretty sure. I mean, you never know. But I thank you. As far as going through the emotional aspects of it, which is one of the things I talk about in my story, my family is all in Oklahoma. I don't have any family in New York. And I was seeing somebody sort of in a New York, not exactly seeing somebody kind of relationship when I was going through all this, which of course led me to realize through that experience that I really didn't need to be in that relationship, nor did I need to be in another relationship that was bad for me. So one of the things that came out of my cancer was pulling away from people who aren't good for me. I did end up having, so they told me to wait, this is personal, but what the hell. It's, they told me to wait, you're supposed to wait 6 weeks after hysterectomy to have sex, and I waited 15, and on that morning, which was really fun, that I had sex again. We went to a museum and we were looking around, and I started to feel dizzy, and I started to feel nauseous, and I started to throw up, and I got myself to that emergency room as fast as possible, and it turns out that my bladder was coming out of my vagina because I had a prolapse. So I think the stitches from the hysterectomy had just not done their job. So I had a little extended recovery to go through. And like I said, and I definitely think I did have the PTSD afterward, and I guess it must have been obvious to other people, because in 2012, when I was doing my routine follow-up at Dr. Curtin's office, the nurse said, there's a study going on now that we think you might like, and some sort of drug post-cancer patient study. And I said, I don't like to do drugs, I don't want to do it. And then she said, well, just talk to them. And so they came in, this tweed jacket guy and this sort of hippie-looking assistant he had, and they said, it's just one drug, one time. And I said, all right, what is it? And they said it was psilocybin, magic mushrooms. So my friend Joe says I'm the luckiest unlucky person he's ever met. So I took mushrooms for science, and I was one of the people who participated. It's been in the page. It was wonderful. It really helped with the PTSD, and it was amazing, amazing, amazing experience. I had visions that came true. I had insights. I had love. I felt connected. I didn't feel lonely. I didn't feel separate. Seriously, it was wonderful. It's worn off, unfortunately. I didn't actually have the best week, but it lasted for a couple of years, and I was happy to be part of that treatment, because I do think it's a good help for PTSD and depression and anxiety. So, thank you.
Well, no. I mean, you're amazing, because I remember when you came in, you said, I've tailored my own treatments, and this is what I'm going to be doing. Turns out for the DCIS, we're all coming around to the fact that, a lot of people are being overtreated, and we don't have to treat everyone with radiation, and it doesn't increase the overall survival. So, I don't know, maybe you're clairvoyant.
I have some intuition. I do.
Yeah, I think you have to have some intuition about your cancer, but sometimes, when someone's talking about the numbers, it's almost like it's hard. Your head can't wrap around the numbers, and sometimes it comes down to, and you know this, and I mean a lot of us know this in medicine. It's like dancing on the head of a pin. There's so little benefit for certain things, and then For other things, you know, you don't want to be the one that doesn't take that medication because, you know, if you get a recurrence, it's because you didn't take that medication, but nobody knows that. So,
Well, and it's your life. So I think at the end of the day, I was, you know, and maybe because I don't have children and a husband, but I just felt like I was making the right decisions. And so far, I mean, the first surgeon told me I had a 50-50 chance of being alive in 5 years if I didn't do exactly what he said. And I did very little of what he said. You know, and the tamoxifen can give you uterine cancer, or it's a great possibility, right?
sure can.
And that's what I
Small,
got.
small percentage, right?
Small percent. I don't mean to freak anybody out, but that's what I got. So I'm glad I didn't do it because maybe it would have been, you know, it just felt like trust my gut. You know, with good medical, you know, assistance, I didn't go running off